Hi, everyone. Welcome to the Mass Coalition of Health Equities press conference on our letter to Governor Baker. We're a group of 20 organizations and nearly 300 physicians, state legislators, community and public health leaders that are urging Governor Baker and Massachusetts legislators to strengthen and implement comprehensive responses statewide to COVID-19. I just want to start by reading our demands. We would like the governor to close indoor dining, movie theaters, casinos, places of worship, gyms, and limit restaurants to carry out only, reinstate the eviction moratorium and pass comprehensive housing stability legislation, implement a state level relief package to protect individuals, save small businesses by tapping into remaining CARES Act funding, and increase COVID-19 texting access, especially in hard-hit communities. And also additionally, pass emergency sick time for patients isolating and quarantining after their exposure, along with increasing funding support to local public health departments and workplace standards. We have a great list of speakers today. We're going to start with Katie Murphy, who is the president of the Massachusetts Nurses Association. Thanks for joining, Katie.
Good morning. Thank you all so much. And thank you very much to the coalition for putting this together. Couldn't be more important, especially at this time. You know, my name is Katie Murphy, and as a frontline nurse and the president of an organization for nurses and healthcare professionals from Cape Cod to North Adams, including frontline caregivers working in 70% of the state's acute care hospitals, I want to offer our perspective on and support for this demand for a more aggressive and comprehensive response to the pandemic. While this administration claims to base its reticence to act to limit public activity on the data, I'm here to tell you that while the administration surveys data, nurses and other caregivers are viewing a different metric. Ours is the metric of needless human suffering and death of our patients. Patients now flooding our emergency departments, filling up our ICUs and other units, patients who come to us after dining in restaurants or working out in gyms, or who have been required to teach at or attend schools that should have been closed for in-person learning weeks ago. We've seen a number of mayors act in their localities to take more aggressive steps to limit public exposure to this virus, and it's now essential that our governor do the same. As nurses, we're tired of hearing how the state is ramping up testing now 9 months into a pandemic, where people wait in long lines for these tests and sometimes days for their results. We're disgusted that while the state can test in some settings, like businesses or colleges, we still have nurses in our hospitals begging to be tested and then waiting days for those results. As nurses, we're tired and disgusted by the fact that we still do not have adequate access to the PPE we need to keep ourselves, our patients, and our families safe. We're appalled to see this administration, through the Department of Public Health, continually weaken infection control standards at the behest of the hospital industry, too often more concerned about its bottom line than its staff and patients. Every day, nurses are being forced to reuse N95s that are only truly safe for a one-time use, or to use masks degraded by an unproven contamination process. Every day, nurses are forced to wear soiled or flimsy gowns not meant for COVID care. For months, we've asked the state to hold the industry accountable for ensuring access to this equipment, or at least to give us a true accounting for the supply in the state, yet no transparency is provided. As more and more nurses have become exposed to the virus and staffing levels have decreased due to the exposure, the DPH, sanctioned by this administration, is allowing hospitals to demand that nurses who have the virus or who live with a family member who has the virus to come to work sooner, under the false assumption that they are protected and that our patients are protected by the wearing of PPE. PPE, as I just described, which is insufficient. Nurses are exhausted and tired of being called heroes in this battle against the virus while being neglected and endangered by the failure of the state and federal government to mobilize the resources we need to fight this virus. And finally, we nurses have a message for the general public. Please, please, please stay at home for the holidays. Practice physical distancing and wear a mask everywhere. I have talked to too many of our emergency room nurses and ICU nurses now treating patients who traveled for the Thanksgiving holiday. Yes, we're all excited to have the access to the vaccine to stem the tide of this pandemic, but the vaccines are not going to reach the general public for months. Right now, as we confront this second surge and the long, cold winter ahead, We need our government to act aggressively, not only to lock us down, but to act in concert with our legislature to provide the funding and resources to protect those harmed by this necessary effort to protect us all. Thank you very much.
Thank you so much, Katie. That was so powerful, especially the idea that nurses are called heroes and deserve to be treated as such. Thank you so much for your hard work. Next, we're moving on to Representative Mike Connolly of Somerville and Cambridge. Mike, thank you for being here.
Good morning, and thank you so much. And first and foremost, I want to associate myself with the comments of Katie Murphy, and really to advocate for. Excuse me, one sec. The phone is. Thanks. Sorry. And really to join this call for the governor to shut down indoor dining, casinos, and non-essential indoor activities. And that's something that we know if we listen to what the public health experts say, if we listen to what our nurses say, if we listen to what the epidemiologists say, that's something that we have to do. You know, yesterday, Governor Baker said he is begging people not to travel and not to go have dinner with their outside household relatives at these holidays, and rightfully so. But at the same time, Governor Baker says it's okay for 6 individuals from all different households to go to an indoor dining space and to gather around a table for 90 minutes and to eat a meal largely without wearing a mask. Most people realize that's a contradiction, that it doesn't make any sense. One of the things that we've noticed over the recent weeks is how many other governors have taken action to stop indoor dining. Governor Cuomo in New York shut down indoor dining in New York City, in Pennsylvania, Minnesota, most of California, so many other states, they've taken this step. My colleagues and I, we sent a letter to the governor a couple of weeks ago, and we continue to call for a shutdown of indoor dining and casinos and other non-essential indoor stuff. But at the same time, we recognize that that has to be paired with state level and federal level financial relief. And so, you know, echoing what Katie said, I feel like we have a moral obligation as legislators, as government officials, to put public health first. You know, Governor Baker talks a lot about his goal of trying to preserve the capacity of the healthcare system. And I have confidence that that is his goal. He thinks as long as we don't overwhelm the hospital system, that he has achieved his goal. But, you know, I would respectfully submit that that's not the right goal. We have communities here in Massachusetts that have been in a perpetual state of crisis. They never saw any of this let up. Places like Chelsea, places like Lawrence, or places right here in my own district in East Somerville and East Cambridge, where we've seen disproportionately high impacts of COVID-19. So I'm pleased to join with you. I'm grateful to all the work of all the folks who are here on this call. And I'm hoping that the governor and other state leaders will do the right thing, shut down these non-essential spaces and businesses, and at the same time deliver those financial supports, emergency paid sick time, guaranteed housing stability. There shouldn't be any evictions during a pandemic, and provide supports to those small businesses so they can go ahead and allow us to get this public health emergency under control. Thanks.
Thank you so much, Mike. I really appreciate your point of how we're seeing other governors take action as well, and it makes complete sense for our governor to do the same. Thank you so much. We have as our next speaker, Lady Lawrence Carty, who's the founder of Housing Equals Health, and also here with the Roxbury Neighborhood Land Trust. Thank you, Lady.
Thank you. Housing Equals Health is an organization of members with lived experience of displacement, including homelessness, founded on the principle those most affected must lead. We fight at the intersection of housing and health. And if this pandemic has taught us anything, it is clear we need housing to have health. Thank you, State Representative Connolly, for understanding this and filing a bill with the real protection families need during this crisis of public health and its devastating economic impact. Whether the COVID economy has cost them their job, their small business, or their lease just expired, families need the housing security your bill provides to keep their children safe during the COVID surge we are trying to stop right now. Black and brown communities were already in crisis when the pandemic began. The same neighborhoods that now have more COVID hospitalizations and deaths already faced a disproportionately high level of evictions in Boston before this pandemic. These neighborhoods have the same underlying condition, race. Indoor air transmission is worse during the winter because lower humidity keeps COVID airborne longer. More evictions, more homeless families. A family in a homeless shelter overnight is exposed to higher risk of indoor air transmission because they are forced to spend the night in shared indoor spaces. The CDC guidance is that just 15 minutes indoors with someone who tested positive for COVID is enough that they should get tested. 15 minutes is a lot less than overnight. Families have to be kept in their homes because we have no safe place for them to go after eviction. The provisions of Mr. Connolly's full bill will save lives. Without it, people will die who did not need to die. Our state government must face the facts and act. Failing to pass its complete eviction and foreclosure protection means more COVID cases and more deaths. We do not have to wait for state government to protect our families. While we fight for passage of this bill, we can act locally to protect our government, our communities rather, via city government. Somerville has already issued a municipal eviction moratorium. All of us can fight for the same local protection from eviction while we continue to fight for the COVID-19 housing stability bill. Municipal eviction moratoriums are not a substitute for Representative Connolly's bill, but they will save lives while we fight for the comprehensive protections in his bill. Representative Connolly and others worked hard to provide regular families the housing security that would reduce chronic stress health problems, such as higher rates of hypertension, diabetes, heart failure in Black and brown communities. These long-term health problems are the same underlying medical conditions causing a higher rate of death from COVID in Black and brown people. There is a reason the life expectancy in Roxbury, where I live, is 59 years, but in Back Bay, it is over 90 years. We need your long-term legislative vision and commitment to regular people, Representative Connolly. Thank you.
Thank you so much, Lady. I really appreciate your point of how, even if we don't have all the solutions now, it's important to minimize the damage and save lives while we have the opportunity before it's too late. Thank you so much. Oh, I muted myself, sorry. Our next speaker is Professor Michael Mina, who is Associate Professor of Epidemiology at Harvard's T.H. Chan School of Public Health. Thank you, Professor.
Hi, thanks. My real interest is to discuss a way that we can make testing more available to many of the hardest hit communities in Massachusetts. We've seen Massachusetts lead the way and under the governor's leadership in testing and really being able to keep higher education systems across New England open and now moving out to K-12 schools within Massachusetts. And we now have tools at our disposal that can be made available immediately, which can increase access to testing in a way that we have yet to see, both in Massachusetts and really nationally. And so I suppose what I would like to try to encourage is for Massachusetts to continue being a leader. We can take tests that are these small little rapid tests, which can be performed frequently we can put the resources that we need to into them and actually get testing into people's homes. We can start to lead the way in terms of equitable distribution of tests in this country in a way that really no states have actually been able to see yet because of the way that testing has largely been distributed across the population. And so these tests are now becoming, of course, available. We've actually had some of the major studies looking at their utility have been done right here in Massachusetts with some of the Abbott tests. And now I hope that we can take some of the CARES Act money, if there is any left from that, and then more acutely some of the new stimulus funding that we'll be receiving as a state, and actually putting it into these tests to get the tests as a major public health program, put the funding into them. And the reason why these particular tests are so important in the response to COVID is, as we are going to see a slow rollout of vaccines, unfortunately, or at least slower than most hope, we still need to get this virus under control. These tests, when used across the population and in communities and in people's homes, can actually give people and can empower people and allow them to have the information they need to help stop transmission to their families and loved ones. And the only way we can do that is not with PCR tests that have 2, 3, 4, 5 days delays, but rapid testing that we can now place into people's homes so that they can use them. They need to be fast, they need to be frequent, and they need to be accessible to everyone. So that's, I hope that we can start seeing these become much more deployed in Massachusetts immediately, really.
Thank you so much, Professor. Also, I apologize for the dog barks you might hear in the background. I really appreciate just your point about how it's important for us to have equitable testing so that we can contain the spread of COVID-19 and also just protect ourselves. Thank you so much. Our next speaker is Dr. Mansa Semenya, who is a physician practicing in Boston.
Hi, good morning. As a member of the Mass Coalition for Health Equity and a family physician practicing in Boston, I have personally seen how the COVID pandemic has unequally affected some communities. Black and Latinx communities have been disproportionately infected and dying at rates much higher than anyone else. While I appreciate the Commonwealth's response to the second surge by rolling back the reopening, it is not enough. Emphasizing personal responsibility is misleading, as there are more societal issues at play, and it's discordant at best when indoor dining, gyms, movie theaters, and casinos are still open and available. In medicine, we screen for social issues that we commonly term the social determinants of health. This can include health access, transportation, housing, language, exposure to violence or crime. And it helps us to identify areas where additional resources can be offered or barriers that may reduce the individual's health outcomes. Increasingly, we've been asking employment and workplace safety as it's become more important during this pandemic. Kind of as alluded to earlier, cities and neighborhoods such as Chelsea or Lynn, Everett, and East Boston have suffered some of the highest rates in the state. And unsurprisingly, these cities and towns are also where a majority of our Latinx and Black frontline workers live. It is a daily occurrence for myself and many of my colleagues to hear from patients who are essential workers that may have colleagues who came into work while sick, potentially exposing them to the virus, or they themselves still go to work while sick so they can continue to afford rent and food and avoid eviction and hunger. I also hear from parents who are unable to stay home while ill and patients who decline testing for fear of the results, or immigration status may be divulged to police or ICE. In addition to these obstacles, as already discussed, testing is still difficult to come by. It can take days, it can even take up to a week to be scheduled just to have a test. And the results may be additional days on top of that. At that point, they may have infected others at work or at home. I'm here with my colleagues to ask the Commonwealth to do more to protect its citizens. I want to kind of reiterate some of our collective ask. Passing a comprehensive housing relief. This really is important during a pandemic. Requiring safe quarantine for a positive exposure or isolation when infected It's really impossible if you're being threatened with eviction or overcrowded conditions. Secondly, and personally for me, as a mother and as a Black physician, I strongly urge the governor to not use police to fill public health roles. It's more important to actually build and strengthen the public health community. This is a time when communities need to trust the administration. And with the backdrop of structural racism, this allowing police to fill public health roles will erode the trust among the community and lead to an increased chance for police violence. Third, we need to strengthen mandatory workplace safety standards, implement regular safety inspections, and provide emergency paid sick leave. And fourth, increasing access to testing and ensuring prompt result turnaround time, particularly in the hardest hit areas that we've already discussed. I want to end by saying that before, but even more pronounced during this pandemic, I see many conditions affecting patients that are not necessarily related to science, but have been really shaped by broader societal issues. And for communities of color, our social and physical determinants of health are largely driven by structural racism. If our elected officials are serious about addressing health and social inequities, then they need to enact policies that protect our essential workers, who are primarily people of color. Thank you.
Thank you so much, Dr. Semenya. I think you made an excellent point. That's kind of like our informal title of this event, Tale of Two Pandemics, that it is both racism and COVID that are kind of both coming to a head in a structural kind of convergence, and that we really don't need police further heavily over-policing our communities by fulfilling these public health rules. Thank you so much. Our next speaker is Natalisha Tracy, Executive Director of the Brazilian Workers Center. I'm actually seeing her. Does anyone know if she's on yet? She might be here a little bit later. If you're on, could you let us know, Natalisha? Cool, no worries. I think she'll be moved later to the agenda. So right now we'll go to Dr. Maddie Ribble, who is the Director of Public Policy at the Massachusetts Public Health Association.
Well, good morning, and thank you so much for having me. I am not a doctor, I will say, but I am the Director of Public Policy at the Massachusetts Public Health Association, and very happy to be with you today. First, I want to just wholeheartedly express the support of the Massachusetts Public Health Association for the recommendations being made to the governor today and to the calls that the previous speakers have made. I want to spend just a few minutes talking this morning about the imperative to support and strengthen our local public health system now. But first, what do I mean when I say our local public health system? By this, I mean our system of local health departments that are located in each and every one of our cities and towns. These health departments are responsible for a wide range of activities that are really essential right now, including investigating suspected cases, making testing recommendations, doing contact tracing, recommending and enforcing quarantine and isolation, also enforcing orders and regulations regarding business operations and worker safety, and supporting businesses to put in place safe operating procedures, and also serving as a hub of communications between city and town officials, schools, first responders, businesses, and residents. And these are just some of their COVID-related responsibilities. They have 100 other regular responsibilities, from food safety, enforcing the housing code, but that's for another day. But here's the problem. The kinds of local health protections you receive depends a whole lot on your zip code. And that's because we have an extraordinarily fragmented system in Massachusetts. While most states have county health departments, Massachusetts has the dubious distinction of having separate health departments in each of our 351 cities and towns, meaning we have more local health departments than California or New York or any other state in the nation. Further, the state provides no direct funding for core local health functions, leaving it up to each municipality to attempt to provide the same set of protections, whether affluent or low income, whether the population is in the hundreds of thousands or simply the hundredths. This is a system marked by deep inequities, and some places suffer more than others. Low-income communities, gateway cities, and other communities of color, and rural towns often face the biggest challenges. And this divide further drives the racial and economic inequities so clear in COVID outcomes. One of the areas we're particularly concerned about is workplace safety. And I know you're going to hear from my colleague Al Vega in a moment about that, but this is an area that local health departments have a responsibility to enforce, but do not have adequate resources to do so consistently. What do we need to do to fix this? For starters, money. Simply put, local health departments need sustainable resources to hire staff to carry out their responsibilities consistently. But it's not just money. We need a system with uniform standards for all communities, and we've got to support communities to work together to meet those standards collaboratively. We simply can't do this 351 times over. And by the way, everyone agrees with this. It was the consensus recommendations of a large multi-sector state commission chaired by the Department of Public Health, which released their recommendations just 18 months ago. But now we have to actually get from here to there. The pandemic has shown us that inching forward toward a solution simply isn't acceptable any longer. There's too much on the line, and we just can't accept the status quo. There's a bill pending before the legislature, the SAFE 2.0 Act, that stands for Statewide Accelerated Public Health for Every Community, and we need the legislature to move on this bill right away. In conclusion, the time to properly fund and reform our local public health system is now, in order to ensure that every resident in every zip code benefits from the public health protections they need and that they deserve. Thank you.
Thank you so very much, Maddie. I think you really summed it up beautifully. Inching toward a solution isn't acceptable any longer. No other better way to say it. Thank you so much. We're excited to hear from your colleague, Al Vega, who obviously works with Maddie. It's the Director of Public Policy and Programs at the Massachusetts Coalition for Occupational Safety and Health.
Thank you so much, Noel. Thank you. Good morning. My name is Al Vega, again, the Director of Policy and Programs at MassCosh, the Massachusetts Coalition for Occupational Safety and Health, a worker health and safety organization advocating since 1976. So COVID-19 continues to be one of the worst global worker health and safety crisis in our history. Numbers are rising, and the Bay State is at the top of the list of states suffering from this unfortunate situation. Workers have been getting sick, hospitalized, and some dying from workplace exposure to this virus, even if that is not what Governor Baker wants you to believe. He continues to falsely claim that it is only individual behaviors that have led to an uptick in cases, and repeats that workplaces have not played a role in increasing the problem we see exponentially getting worse day by day. As was just mentioned, we know that there are higher rates in communities of color, where we know that Black and Latinx workers are disproportionately employed in those essential jobs that puts them in higher risk of getting sick and spreading the virus to family members and the community. And we will probably never fully know the impact on workers, because although legislation was passed this past June, the state has failed to collect adequate or useful enough data on the occupation and the employers of these cases where outbreaks or clusters of infections may be occurring. The data we do have shows that thousands of worker complaints to OSHA with little response, leaving the state as the workers' only hope of protection. As of December 8th, there have been close to 1,400 complaints from workers received by the Department of Labor Standards, an agency with which under a dozen inspectors statewide. It is estimated that close to 45% of these have resulted in state finding violations of these regulations. DLS has only been able to investigate a small fraction, 64 of them, as possible workplace clusters identified through contact tracing. And as was already mentioned, we know that complaints that go directly to local boards of health, who are also under-resourced, sometimes result in that not being tracked in a way to see the bigger picture of how this is leading to higher workplace transmission across the state. Number 12, through our local public health allies, we've learned about hundreds of clusters in childcare and industrial settings, and mainly because of indoor dining, restaurants as well. Gyms also being some of these locations where numerous workers are getting sick. We are also hearing that schools are beginning to be places where not only students, but also staff and teachers are getting sick, as our state continues to push for more in-person learning, but no real plan or resources to do this safely, and punishing those who can't figure it out on their own. It is clear that workers are not being adequately protected from exposure to this virus here in our state, despite the mandatory workplace safety standards our governor put in place this spring and the recent regulations approved months ago. which still exempts too many workers and lacks the additional enforcement tools or ability to prevent retaliation for speaking up, which continues to be a reason why workers are afraid to speak up. Our Worker Center has focused on responding since the shutdown and has helped workers file for unemployment, find housing benefits, and food banks. We are hearing more and more that it is harder to file workers' comp claims, no matter whether you are a domestic worker or an iron worker, to get the benefits that you deserve if you contract COVID-19, as employers and insurers are claiming community spread and denying these claims. So we know that it is not helpful to have Governor Baker echoing these same sentiments as we continue to see our community suffer and deal with the fallout of the pandemic. So as workers continue getting sick and hospitals continue to see COVID-19 patients coming in, isn't the most common sense approach to help workers from becoming sick by doing all we can to protect them and also allow businesses to shut down in a safe and just manner? It is one thing to ask for people to stay at home and be safe, but that cannot be done without a significant safety net for workers and those small businesses who will continue to suffer and struggle daily without any real help if there's no income or enough coming in to cover bills or expenses or pay those workers. When workplace clusters of COVID-19 are happening at your workplace, no one should lose their job or their business because they chose to keep safe, take care of a loved one, or close down a family business and hope for the best. So in order for us to see a just recovery, our governor and leaders must act now to proactively reduce and control current unsafe working conditions. So reinstating those stronger restrictions on certain places of worship, gyms, casinos, and indoor dining, enforcing and strengthening those mandatory workplace standards, implementing regular inspections and allowing people to go after egregious employers when they fail to maintain safe working conditions, report contract tracing monthly, especially the percentages tied to workplaces, updating workers' compensation rules to allow for the presumption of occupational exposure for any worker who may have contracted the illness at work, and providing safe alternative transportation for PCAs and home health aides, just to name a few. We know there's so much more that we can do, and as you've already heard or will continue to hear today, other states like Virginia, Kentucky, Michigan, and California are doing more, and there's no reason we can't either. Our state must do more now if they really want to remedy the racial injustices and harm done to our communities as a result of this pandemic and the response so far. I hope our governor is listening and that he does the things that we urgently need him to do so that we can help working people and small businesses across our state. Let's not leave anyone in our state having to fend for themselves when they get sick, or in the worst cases, infect others, become hospitalized, or lose their lives simply because our state didn't do enough when it could to ensure that we all survive this pandemic, no matter if you're a white collar worker, a blue collar worker, a gig worker, or an undocumented worker. Thank you so much for your time.
Thank you so much, Al. It's so refreshing to hear that. I mean, I feel like we see Baker doing what you're saying, putting a lot of blame on the individual when you're not acknowledging the fact that his inaction has made workplaces unsafe. And you can't just simply stay home, socially distance, not work without that safety net. It's really unrealistic. So thank you so much for emphasizing that. Our next speaker and final, muted myself again. Our next speaker is Colin Killick. He is the Executive Director of the Disability Policy Consortium.
Thank you so much, Noelle. So our organization is a statewide independent civil rights advocacy organization run by and for people with disabilities. And I am here to raise the concerns of the more than 20% of Massachusetts residents who have disabilities. Because while the responsibility of acting safely to contain this pandemic, it may be equally shared, the risk from this pandemic is not equally shared. For some people, contracting COVID-19 will mean being out of commission for a week. For far too many people with disabilities, it means significant risk of death. More than 2/3 of those killed by this pandemic in Massachusetts so far have been people with disabilities, both under and over 65, primarily in congregate settings, nursing homes, obviously, but also mental health facilities, group homes, prisons, other places where large numbers of people, primarily with disabilities, are concentrated. Hundreds of thousands of our fellow citizens have conditions like cancer, diabetes, heart disease, sickle cell anemia, and asthma that put them at elevated risk of death from COVID-19. And it goes beyond physical conditions as well. A study last month nationwide found people with intellectual and developmental disabilities are 3 times more likely to die of COVID-19 than people who are in the general population, despite which people with intellectual and developmental disabilities are not presently at elevated priority for the vaccine. Even for those members of our community who don't contract COVID, this pandemic is having a profoundly negative effect, from vitally needed surgeries being delayed, therapies going unprovided. We've even heard from people who need to use home ventilators to breathe that they are struggling to do so because their ventilator circuits are being diverted to overburdened hospitals to keep those ventilators running. I was on the committee that drew up the most recent version of the state's crisis standards of care, and I'm very proud of the work we did together to remove discriminatory language. Having tremendously difficult conversations to finally come around to the notion that every life of a Massachusetts resident is equally worth saving. But there is no getting around the fact that if we get to the point where those standards actually have to be used, a tragedy has already occurred and people are already dying, simply because there aren't enough resources available to treat them. When we signed off on those standards, we believed it was likely that they would never actually need to be used, but now that is looking less and less certain. So our ask simply is that given that the infection rates are higher than they have been at any point in the pandemic, the safety measures need to be stronger than they have been at any point during the pandemic. Anything less than that would leave people with disabilities in this state at a frankly unconscionable level of risk. Some things are more important than economic growth. Thank you.
Thank you so much, Colin. I apologize, I have my camera off for a moment, but that was so powerful. It kind of reminds me as well of how in the beginning of the pandemic, people were donating hand sanitizer from their closed businesses, gyms, people were offering gloves, doing a lot of that when the government should have been providing those resources to hospitals instead of the burden being on us. So thank you so much for reminding us of the importance of making sure that resources are allocated. Thank you. I'd like to also introduce Lara Germanis. She is a primary care doctor practicing in Revere. She's a member of our coalition, the Mass Coalition for Health Equity. And I'd just like her to wrap up and make some amazing points. Thank you, Lara.
Good morning, everyone, and thank you for being with us. This is such an important convening of many different leaders from many different aspects of work and the public domain in this in the midst of this pandemic. And what it really brings to light is how the pandemic really just cuts across all aspects of life, from public policy to the workplace to health. And Governor Baker's repeated focus on the individual as the solution to controlling the pandemic and insisting that people need to stay home and not interact with others is really not going to curb infections, because there are many people who don't have a choice but to go to work every single day where they are exposed to COVID-19 and then bring it home to their family members. And so if there's one message that we can drive home, it is that the risk of infection with COVID-19 is structural. And that means that people, and that means that the solution also has to be structural. It has to be comprehensive. And so when we are trying to prevent COVID, we can't simply increase, we can't simply tell people to stay home. We can't simply increase access to testing, because once you know that you have a positive COVID test, I have patients that don't want to get a COVID test because once they have the result, they can't do anything about it. Once they have the result, then they are forced to know or to be afraid that they can't go to work because they won't be able to put food on the table, they won't be able to pay rent. And that's why we need comprehensive legislation that provides family leave, that bolsters the inadequate aid package that was just passed by Congress, and that makes it possible for working people to comply with these restrictions. And in closing, I just want to emphasize some points that our speaker, Natalicia Tracy, had made, which is that community members out in communities of color were struggling for workplace safety even before the pandemic. And so now when frontline workers' families can't eat if they don't work, employers are exploiting people's needs by ignoring safety. And so we need to make sure that we are improving and strengthening the protections that do exist for workplace. And because workplace infections are driving the pandemic in this state and disproportionate sickness and death among communities of color, that actually is institutional and structural racism. And so if our elected officials are serious, like they said, about protecting the health of Black and Brown communities, then they need to put their policies where their mouth is and make sure that we really have policies that make it possible for families to protect themselves from COVID, to make sure that they have access to testing, access to treatment, are able to stay home from when they're sick, and that they have a home to stay in. Thank you so much. Now I'm just going to ask all panelists to turn on their video, and Noelle can read us off some of the questions that have been appearing in the chat.
Thank you so much, Laura. I'm just going to wait until everyone has their screens on. And also, everyone watching, feel free to submit your own questions. We can see them as well. I'm just going to start us off with some of these that have come in. So the first one is, given what we know about, and anyone can take these, given what we know about social determinants of health and their disproportionate impact on communities of color, do you have any strategies and suggestions for long-term reform?
I can answer that. I'm sorry, my video is not turning back on, so I'm not sure, but I'm still here. I think Laura actually, there we go. I think Laura actually kind of answered those questions in her last statement. I think the key thing is recognizing the effect of structural racism and how that really has shaped our social determinants of health. And from that, really starting to identify areas where that occurs. So in our policies, in our governance, and kind of our healthcare institutions, and really trying to look at those areas where structural racism has been active, and really starting to change how those policies are put into place. And so thinking about going as far as housing and thinking about environmental justice and thinking about workplace safety, and even in healthcare, thinking about our insurance policies and who gets access to what clinics and where, and kind of starting that, looking back and really thinking about how structural racism plays a role and how basically anything in our society, in our culture really is based on, and really trying to re-envision things that don't necessarily rely on structural racism as part of the policy.
Thank you so much. Does anyone else have anything to add as well?
I'd like to.
Yep, go for it, lady.
In terms of structural racism, systemic policies, there are well-intentioned people who say that we need to do something about housing insecurity because of the health impacts, who will promote policies which are ad hoc and don't really address the root cause. So, for instance, Representative Connolly had a bill, local options for tenant protection, which would, at a structural and systemic level, reach people quickly by giving communities the ability to enact housing policies like rent control, which give that security in a broad way without having to address, each individual and mobilize to address each individual case. So I just want to echo what the doctors just said and what Laura said also.
Absolutely. Thank you so much to both of you. I do have another one. What can local nonprofit groups who want to fight the pandemic do right now to help move forward this agenda, other than just sending petitions to the governor and op-eds to the press? Good question. And any panelist can take it, feel free.
Do you mind if I jump in? Number one, this has been incredibly powerful, all the comments that were being made, but I think taking it a step further is so really responsible legislators like Rep. Connolly, are putting these policies forward. And I think it's time, I think groups active in their community can put pressure on local legislators and work our way up the ladder, all the way up to the governor's office. It really matters who we elect to these seats, and we have to ask them these hard questions, ask them what their specific plans are, and then keep the heat on them. I'm not talking to you, Rep. Connolly, but I mean, they work for us. I never forget that. They work for us. And so we can, just keep the pressure on. Back in March at the beginning of the pandemic, it was clear to me in my intensive care unit, clear to me when I saw the patient population that was there, that if you didn't think there were health inequities before that, it was in stark contrast that day. And that is structural racism. It is housing insecurity. It's actually, and I believe that businesses somehow have to be protected as we fight this as well. And so we need these thoughtful politicians. And I think community groups are very powerful by keeping this pressure on.
Could I thank you for that? And if I could just jump in, it's truly a moral question, what we're facing. The response from Governor Baker and the response from government in general, it makes sense if you assume that there is no other way that we can draw upon financial resources to support frontline workers, to provide the PPE, to deploy testing, to invest in HVAC systems, to do rent relief, to provide emergency paid sick time, to provide support to small businesses so they can responsibly shut down. All of these things are things that would require additional resources. And what are we living through right now? The most profound wealth and income inequality, which of course is completely tied up with structural racism and white supremacy. And the leaders in this state, including Governor Baker, their default position is that they do not think it would be possible to readjust or reallocate the distribution of wealth or the distribution of resources in our society. And because political leaders are unwilling to consider a readjustment of resources and a readjustment of wealth and how we choose to use our revenue, that means people of color are going to disproportionately, unfortunately, get ill and die. That means that low income, working class folks are unfortunately going to get ill and die and suffer the effects of COVID. And that is simply a moral outrage. And, as an aside, that's why in the recent House budget, I felt compelled to bring forward a proposal to raise new additional revenue. And in our recent letter to the governor, in addition to raising revenue, we point out other options. The state of New Jersey, just a couple weeks ago, issued a $4 billion bond. And what they did was they went out and they borrowed $4 billion and they said, we're going to use this money to help with the COVID response. In Minnesota, just a couple of weeks ago, they passed a significant package to support restaurants and bars so that they can shut down. They sent resources over there and now they're doing the public health thing. So yes, to pick up on what Katie and others here have said, we are making a fundamental choice to protect wealth and to protect inequality at the expense of Black lives, at the expense of people of color, at the expense of working class folks. And that is morally unacceptable. And that's why I stand here in solidarity with all of you and continue to raise these points in the legislature.
Thank you so much to both of you. We also have a question regarding distance learning, and I'm going to direct it to Colin. It was directed to Colin in the chat, and of course after anyone else can comment as well, and that is the impact of distance learning on low-income students with disabilities has been stark. Do you think that a plan of action should be instituted to address not only the academic losses, but also the emotional trauma experienced by these students and by all students?
That's a phenomenal question, and I think the answer is absolutely yes, right? Students with disabilities are entitled under federal law to a free and appropriate public education, and that appropriate part really has dramatically fallen short over the course of this pandemic. I have enormous empathy for school systems in figuring out how to provide accommodations in virtual settings, but they're at this moment woefully insufficient and don't seem to be getting better, and we need a clear plan for how students who require accommodations are going to get them, whether it's through virtual means, whether it's through some specialized means of getting in-person instruction specifically to students with disabilities in a manner that's safe. And once the pandemic is over and students are back in school, we are going to need substantial investments in special education in this state to begin to bridge those gaps and to address that trauma that I think it raises, which is absolutely the case.
Yeah, I just want to echo the need for those resources for schools to actually allow for in-person learning to be done safely. I think, as I mentioned in my remarks, there's been this push, particularly by our local agencies, to really kind of put that as the main message, do everything we can to ensure our students are back in schools. But we know that there's so much disproportionate resources throughout the state. So in a community like Wellesley or Weston, I'm sure the ability to do in-person learning for any students is going to be much easier than, say, in a community like Brockton or Springfield. And I think that's what a lot of folks, not just teachers unions, but parents and other advocacy groups have been saying. We understand this need to ensure that all those folks that really do need some kind of in-person learning, because the virtual remote learning does not provide appropriate or sufficient kind of opportunities for them. Let's figure out what additional alternatives there are other than just asking folks to open up buildings and then figure things out as rates start to go up or people start getting sick. That's when action then starts to happen. I don't believe anybody should have to sacrifice themselves either for their education or for a job, which is what school buildings are. I think that's one of the pieces that people are forgetting. They're asking staff and teachers to just not care so much about their personal needs, but sacrifice everything for students' needs. And I don't believe that's the message we should be having at any level in our state. And we need to do more to ensure that we can make sure that any person that goes back into a building can do so knowing that they're not going to get infected or bring that back home.
I'd like to quickly echo on that. One of the things, talking to Black teachers here in Roxbury, to parents also, there's the impact on students with disabilities and also students just in our public schools. They're seeing that the need for a large effort to overcome the lost ground from what's happened. So the impact as a previous speaker just mentioned, Al mentioned, in a wealthier neighborhood, wealthier school district isn't going to be as great. But so instead of cutting budgets for education, they need to be increased.
Right.
Absolutely. It looks like we don't have any more questions. So I just want to give our panelists maybe, maybe a minute each or so, or possibly less if you can, for final, just wrapping up closing statements. And that way we can end around noon.
I'm happy to just briefly start. I think that Rep. Connolly really summed it up well when he said that Governor Baker's policies are really putting wealth first and human life second. And it's really important right now, if we're serious about taking action against inequality, if we're serious about protecting human life and communities of color, then we need comprehensive policies to do that. And we need them to protect people's ability to access food and shelter and healthcare. And in the midst of this pandemic, millions of people are months behind on rent and really struggling. And meanwhile, billionaires have made billions of dollars. And so while we can't allow corporations to profit off this pandemic while so many others are suffering. And that's why we need to make these changes now. And as a family physician, this is a medical issue. These social policies that can be made, they are the prescription. They are much more effective than any monoclonal antibody. They're frankly more effective than any vaccine, because in order for the vaccine to work, we need to also have a manageable size of the pandemic. We need to have public trust in the system, and that's the only way forward.
I wonder if I might add, we have heard that the governor is going to be announcing some additional restrictions today at 1 p.m. So I encourage people to look at that. The list I've seen really does represent a half step in the right direction and does not respond effectively to the calls that we've made together today. And we've seen the governor over and over again, basically every day, explain to us that he's following the science. And we see over and over how that's not true, in instance after instance, where the science points in one direction and the governor's policies go in another direction. So ask the governor today, using all of your communications channels, what is the science that supports these moves? And how do these moves address the real needs of people in our communities that are suffering, because they are not based on science. But we have seen the governor respond to public pressure, and there's been growing pressure from all of us, from medical professionals, public health professionals, community residents, organizers, and we're going to have to keep that up on behalf of all of the folks that we work with and all of our neighbors and loved ones. So I just want to say thank you to everyone who's been a part of this. We are making progress, and we have to keep pushing hard.
We do have to ask Governor Baker to face facts and the state government just to face facts. When there's this ill-advised call for, personal responsibility, Black, brown, and working class people who are forced to be exposed at work, that's not a question of personal responsibility. As a matter of fact, this is a pandemic that hits. There's two pandemics. There's a pandemic, in Roxbury. There's a pandemic in wealthier neighborhoods like Back Bay, and they're not the same. 1 in 2 Black families being at risk of eviction at this point due to the economic impact of COVID. 1 in 2 versus the overall rate, something around 13%. And it's Representative Connolly's systemic legislation, that's the only way to address structural racism, because it's a matter of the structure. And if there can be a well-intentioned person, but if you don't change the structures, you just get ad hoc results.
And I think I would just add very briefly that for people with disabilities in this state, in this country, have been systematically marginalized for a long time. We've been systematically institutionalized for a long time and have spent decades arguing for community living. That it provided that institutions degraded the dignity of people with disabilities. They degraded the choice of people with disabilities. And it turns out now that they also endanger the lives of people with disabilities. Right. So I would just add, in the near term, we need policies to keep people in the community. We need an eviction moratorium to ensure that people can remain in their homes where they're safest. And coming out of this pandemic, we need a fundamental rethinking of our current system and a shift away from nursing homes and other congregate settings as the default option for members of our community.
And I would just add that we are louder together.
Yeah, I would just add that I think, as has been stated, we need to stop spreading the false narrative that, there's not a bunch of things that our state can be doing to help stop the spread other than individual behaviors being checked. I think that is something that is doing an injustice in terms of how we respond or what people are doing in terms of where they go to work, how they, what they do. And so I think these are the kinds of things that we've been saying since before the reopening guidelines were rolled out. So these were the things that we were concerned were going to happen. So the data doesn't lie. We continue to talk about what is happening, what our agencies are seeing in our response. And it's really scary to think that if we don't change that trajectory, I don't see our numbers getting any lower, and that we're going to be having more obituaries to read this coming spring.
I actually had one more comment to make, which is to, say that we do have many tools to make these changes and to control this pandemic. But leaving, if we want to save restaurants, the key to saving restaurants is not keeping them open. It does not take an MD or a PhD to know that indoor dining is not safe. You put members from different households inside of an establishment and have them talk and breathe in the same space. That is a key way for the virus to spread. And so if we want to save our restaurants, don't send people in there. If you want, you tell people that it's their responsibility not to gather, but then you ask them to gather in restaurants.
Right.
The state is sending people mixed messages. And if we want to protect people's lives and protect our restaurants, then we fund the restaurants with an aid package to allow them to safely shut down. And we tell people that they should not be indoor dining with members outside of their own household. There are many solutions we've heard today, and I think I'll perhaps let Rep. Connolly take us home here as we're wrapping up.
Well, thank you for that. And, I guess it's all been said. I'm so grateful to be here in solidarity with all of you. The final point I'll add, I guess I didn't touch on it enough on the housing matter. This COVID-19 Housing Stability Act, it is not about pitting one group against another group. It is about saying we are going to provide support to renters, to homeowners, and to small landlords. And with the federal package that was just passed, we heard that there will be, I believe, on the order of $25 billion to support tenancies. That's a great reason for us to now move forward with the Housing Stability Act, knowing that hundreds of millions of dollars will be coming into Massachusetts to help guarantee housing stability.
Mm-hmm.
Thank you so much, everyone. I just add my voice to everyone in the chat, just saying thank you for all of the work you're putting in. Thank you so much for taking the time today. And thank you for being so bold and strong and unapologetic and speaking the truth that is frankly being suppressed, that we're not hearing enough and that we need to hear even louder. Thank you literally so much. Let us know, obviously, if there's anything we can do. Thank you to all members of the media who are here as well, helping us spread this message and helping us hold the governor accountable. And yeah, thank you also for all attendees for taking the time out of your very busy and stressful days to join us as well. And as I think Laura said it in the chat, but there will definitely be a way to access the recording later. If you provide your emails, is that kind of the way that people can get in touch with you, Laura? Perfect. Yeah, if you just provide your emails, we can give this out to you. You'll be able to share it far and wide. And yeah, I think that's it for all of us. Thanks so much.
Thank you for doing this, and thanks to all the participants.
Thank you, everyone.
Stay safe.